Well, morning everybody. A special welcome to the Coxdad community, to the parents at St. Patrick's College, to the teachers from our community, and to the many pupils who will be watching this particular interview. Today we're very privileged, or I'm very privileged to interview Dr. Brett Craig. Just for the record, my name is Philip Hawke. I'm the headmaster of St. Patrick's. And we felt it would be a really good idea to speak to a local doctor about the big topic on everybody's lips at the moment, which is the return of pupils to school during this Covid-19 pandemic. A little bit about Brett. Brett's been practicing medicine for about 35 years. He is a GP, has been in Coxdad for a long time, and was one of the doctors who was instrumental in the construction of the private hospital here in Coxdad. So Brett, welcome to you, and it's great to have you with us. So the first question that I wanted to ask you this morning, Brett, is we experienced quite severe winters here in East Griqualand. As a headmaster, I know that this is the flu season that's coming up. So the first question is, are we at serious risk here with COVID-19 at this particular time of the year? Is it any more risky than any other time of the year?
Phil, can I please start with a disclaimer?
Yeah.
Children's health,
Yeah.
parents' rights
Yeah.
are a highly emotive issue.
Yeah.
So this is not a blanket advice to parents. Parents need to decide for themselves
Correct.
what they need to do. Nationally and internationally, I don't think there are any experts on corona.
Yeah.
This is a brand new virus and everybody's still learning about it.
Yes.
So there's no definite answers and things change from day to day. So having dispelled the disclaimer,
Yeah.
are we more at risk for corona? Certain pediatricians are telling us that children are possibly going to be a lot less sick and safer this year than at any other time because of the focus on hygiene, wearing of masks and social distance. So I think children are safer this winter than previously. The only advice I can give is that there should be a focus on getting your child vaccinated with the flu vaccine, because you don't want to get coronavirus together with flu simultaneously in the winter. So a flu vaccine is a definite indication, and everybody should get one.
That's quite an interesting observation. There's something else, Brett, that's come up, and I mean, you read a lot of stuff on social media and so on, but there's this thing going around that there's a special virus or a special strain of the virus which affects children. Is there any science to back that at all?
To my knowledge, there is no special science about a special strand or a special subtype of corona virus that affects children.
There isn't?
No.
Okay. Doctor, what sort of preventative measures should parents be taking when children return to school? The one thing you've already said is that they should get their children vaccinated on the annual flu vac. Is there anything else that you would advise?
COVID-19 is a virus, so there are standard precautions that need to be taken. The best advice I can give to parents is teach your children how to wash their hands.
Yeah, how far up the wrist and so on.
And frequently. So whenever you think you should need to wash your hands, wash your hands. Okay. So the biggest risk is transmission from one person's set of hands to a surface to another person's set of hands to the face. Okay. So if you can teach your children about hand washing, basic hygiene and social distance, I think it would be important. The next thing is that your child should wash their hands on entering into the school, and they should wash their hands on leaving the school. So should there be an infection, it's not taken back home.
Okay, I get that. That's really good advice. Brett, there's been a fair amount of talk about children being two things, being super spreaders of this virus or of viruses in general. So the first question is, what evidence is there to suggest that children are more likely, A, to get the virus, and B, to spread the virus?
Phil, as I've said, I'm not an expert.
Yeah.
I'm going to base my comments on Professor Green from the University of Pretoria, who says the following. Don't panic. The children are specifically not super spreaders of virus, and paradoxically children are less prone to getting the virus worldwide. Okay, there have been less pediatric infections than there have been in adults. This seems to be a disease of adults rather than of children. And to date, there hasn't been one pediatric death from COVID-19 in South Africa.
Not one.
Not one.
Where do we know what age that would apply? Up to 10 years old or teenage years or what?
The children that are more susceptible to COVID, according to Professor Green, are the children that are older than 15 years, because they behave more like adults than as children. Okay, so there are two pediatric groups that are vulnerable: the ones under the age of 1 and children older than 15.
Oh, okay. Well, I've learned something new. I was not aware of that. Thank you for that, Brett. Just to move on to the emotive issue of children returning to school. Doc, what's your take on this? Because as a headmaster, certainly I'm looking at it from a medical point of view. The increased risk of infection, people being closer to one another, large numbers of people moving around. But I'm also looking at it from an educational point of view, from a psychoemotive point of view, children being involved with engagement again with their friends, with adults, teachers, and so on and so forth. As somebody who's obviously a GP who's involved as much in medicine as in counselling, what is your take on this as a GP? Do the benefits of returning to school outweigh the benefits or the risks of greater risks of contracting the infection?
Again, I'm going to base my comments on a webinar that was convened by Discovery Health, where they got 3 eminent pediatricians from the University of Pretoria. And their strong view is that children are much better off in school than at home. And they are strongly advocating that children should be at school for psychological reasons and development reasons. And that teachers are best placed to teach children, okay, and parents are best placed to parent children. And parent teachers, although they might be trying very hard, do not substitute for the educational process that happens in the school environment and within the classroom, and also with the peer interaction. So their strong advice is that children should go back to school. Now there's a caveat. There are certain categories of children that might be at a greater risk of
talking about comorbidities here.
Comorbidities. And the groups are the following. The ones that are especially at risk are poorly controlled asthmatics. Now I specifically say poorly controlled asthmatics. Diabetics, immunocompromised children. Those are children that are perhaps receiving chemotherapy, have cancer. Okay, and then a very interesting group is the obese children. Obese children are more liable to get severe COVID than non-obese children. And there has been a concern that with the lockdown, children have gained a lot of weight staying at home and not being involved in the school process.
So no sport exercise.
No sport. Well, not so much sport. It's not
a change in eating habits, and access to the fridge and things like that.
Access to the fridge and becoming a couch potato. Okay, I know that sport might not be allowed at school, so it's not that kind of sport, but it's just the activity of actually being around other children.
The issue of symptoms, I mean, it's fairly well published what the symptoms are, but maybe you would like to take us through this. If I look at a child, how would I know that the child this is a particular COVID symptom, or am I actually just looking at the seasonal flu?
As I said at the beginning, COVID is a viral infection. And viruses that attack your upper respiratory tract or your lower respiratory tract, your chest, present in a similar way. So there is a much higher chance of your child getting flu. Now, when I talk about flu, this is influenza, not the common cold.
Not the common cold, yes,
okay,
understand
this is
that.
Influenza.
Yeah.
Respiratory syncytial virus, and also just another infection. So the most important thing is that in this COVID flurry, we've forgotten that the other illnesses that affect children are
still there
and a lot more common.
Yeah.
So when you are exclusively concentrating on excluding COVID or preventing COVID, okay, you are going to run the risk of missing the other illnesses that might just normally affect children. So my best advice is that should your child develop symptoms, you need to seek professional medical advice straight away for two reasons. One, you need to actually know what the cause of the problem is. And secondly, should your child have developed COVID, it's very important from a community point of view that is dealt with as quickly and as speedily as possible.
In the school context.
Particularly in the school context.
Yeah.
So this is an individual parent responsibility to their own child, but it's also a community responsibility to the other children and teachers in the school.
Right, so it's actually looking after the community and not just your own child.
Yeah.
Actually, yeah.
And I think the best way to look after your own child is to look after the community.
Yes. No, point well made. Brett, is there anything, if you were looking at me as a headmaster with a school that's opening on Monday morning to taking grade 12 and grade 7 pupils, what would you be saying to me? What special measures would, apart from the usual deep cleaning, sanitation points with hand washing and masks and taking the temperature, is there anything special that you would like to say to me that you would like to see happening in schools to improve safety?
I think a school is no different to a healthcare facility in a hospital.
In the context?
In the same context.
Yeah.
We're talking about a collection of people, okay, in a confined space, coming from different areas and different homes and different community and different workplaces. So this is a collection of people, and certainly in the hospital context, we've actually we've gone through a process with Netcare where they have been extensively involved in tracking how infections are transmitted within the hospital context from one patient to another patient and to healthcare workers. And their take-home message after a full investigation done by the University of UKZN is that hand washing
is the critical one.
Is a critical factor. So much so that they're almost telling us, do not wear gloves, because gloves are a false sense of security, and the gloves themselves become a transmitter.
Yeah.
Okay. So
Understand it.
I think if my message to you, yes, you've got the sanitizers, you've got the deep cleaning, you've got everything else. I think perhaps a lesson on and hand washing, all right? And certainly in our hospital, we ring a bell every hour to remind our nurses to wash hands. Okay, so perhaps there might be some PA system where
we've got a very big bell here. We can do that.
Yeah, you ring a bell and everyone washes their hands. Okay, and that's so it becomes an absolute habit.
Good idea.
An absolute habit within your environment.
Yeah.
Okay, all right. I think your risk of as a school of somebody saying that a child left St. Patrick's and took this infection home or to another community would be lessened by actually making sure that your children wash their hands before they get in the car to go home.
Yeah. Just in terms of getting sensible advice, the internet, social media, you can get free advice from 1,000 different sources. But as a medical practitioner, Brett, apart from focusing on your own local GP, where can parents get really good advice? I mean, which sites should you be going to for advice?
Full, I have no advice on that.
Yeah.
Okay, because the internet and the sites are difficult to interpret, and listening to medical experts, whether they be adult attending physicians or pediatricians, they are still trying to digest the data.
So
okay.
you could actually get conflicting.
You could get conflicting, and you could get very confused. At this stage, there is no known treatment for COVID. Okay, there is no specific drug that actually kills COVID. Okay, so until we have a vaccine, the most important thing is to actually give supportive therapy. And if I had to give
symptoms,
if I had to give some advice to parents, is say, you are best placed to know whether your child is sick and is actually changed in condition, and should you as a parent who is going to closely observe your child think that your child's condition has changed, go and seek medical advice quickly so that this thing can be diagnosed and closed down. Remembering that other illnesses like respiratory syncytial virus, normal pneumonia, and perhaps not in your community, TB, malaria, all those other things are a lot more common, in actual fact a lot more deadly than the coronavirus itself.
Yeah. So we've actually got to be quite careful, what you're saying, doctors, not to take our eye off the ball.
Yeah.
As far as winter infections go.
My advice to mothers particularly is that they always ask me, what should I look for? And I say, you as a mum will look for it a lot more closely than I'll ever look for it. Okay,
correct.
Because you know your child, and you are more tuned to your child's change in condition. So any change of condition, okay, go and seek professional advice, because in children this disease can present as vomiting and diarrhea. It's not always a respiratory illness.
So it's not always coughing and temperature.
No, it's not always that.
Doctor, we're at the end of the questions that I think would have interested our parents and our community. So really, I want to just close by asking: Are there any other pieces of information, advice that you would like to give parents that I haven't touched on today?
Vaccinate, and vaccinate.
Okay.
Whatever you can vaccinate against, vaccinate. Okay, that would be my advice. Okay, and.
Is there any evidence that suggests that just the common flu vaccination would be of any benefit if you got coronavirus?
No.
Not yet.
The flu vaccine does not actually help you to fight COVID. But what it does, should your child present with a cough and a fever, okay, and you've had the flu vaccine and it's effective, you can exclude that as the cause.
I see, straight away.
Well, it gives you a strong indication that this shouldn't be influenza. Okay, all right. But if you haven't given your flu vaccine,
You wouldn't know.
You wouldn't know. So I can tell you, just from again relating our experience as a healthcare facility, which is similar to a school. Okay, every single healthcare worker at the Coxdale Private Hospital has received a flu vaccine to prevent them actually getting flu. All right, and I would.
That's an interesting observation, because I know that there's several of the boys' boarding schools and girls' boarding schools here in KZN that line up their kids at the beginning of the winter, so the end of the summer season, and the vaccination is given to the whole school.
Yeah, I would also line up the teachers. I think they're more at risk.
Dr. Beck Craig, thank you very much for joining us today. It's been a great pleasure talking to you. I know that you are a busy man. I believe that our engagement is going to be very useful to many parents that are contemplating this decision to send children back to school. And I hope you've enjoyed the interview as much as I have this morning.
Thank you, Phil. It's a pleasure.